Hello, I'm Dr. Christy Sutton. Thank you for joining me today. I'm excited to talk about skin today and skin health and how it relates to the microbiome and to your gut and to your vitamins and minerals and so many important things. So many important things. It's an important diagnostic tool. It's a window into your insides. And it's not like many things in healthcare not being treated the way that it should. This is a topic that's near and dear to my heart. If you look at the image of this female on this first slide, that is basically what I looked like for a long period of time. I had the worst acne rosacea, and it was terrible. And it was such a emotionally challenging thing. I'll talk more about that in the course of the next hour. But this is a really important topic, and increasingly more and more people are having skin issues, which reflects a problem on the inside. And so, unfortunately, dermatologists are not using the tools we're going to be talking about, which means that it's important that we learn this information. So let's dive in. Disclaimer, this is for educational purposes only, not intended to diagnose, treat, or prevent. So the skin's really an amazing thing. It's the largest organ in your body. It's a detox organ, the body's largest organ for elimination. It's the largest organ in the body. So, of course, it's the largest organ for elimination. It acts as a supplemental filter to the liver and kidneys. So if your liver and kidneys cannot handle what's going on, it'll often exude that toxic substance through the skin. And the ability to exude and remove toxic substances through the skin, it basically takes stress off of the liver and kidneys and the rest of your body rather than those toxins being stored in your cells. The skin can throw off about 2 pounds of toxic waste a day in the form of perspiration. Of course, you have to be sweating. If you're the type of person that doesn't sweat, it's not a good thing. It's a bad thing. It's important that everybody is sweating. Often people, as they get healthier, their ability to sweat will increase. Some people are just naturally good sweaters. They may not like it, but there are health advantages to it. One of them is being able to sweat out a lot of those toxins. Of course, those people that sweat a lot need to watch their electrolyte levels really closely too, because you're also eliminating a lot of electrolytes through your skin. It's an important tool for temperature regulation. So that's one reason that we do sweat. And people that can't sweat, it's really a dangerous thing. They can overheat and have heat strokes. It's a key part of our microbiome. And it's protective. You think of it as it's really protective from the rest of the world. If you have fragile skin, unhealthy skin, you're more likely to get infections, cellulitis, staph infections, just, general infections. It's a window into somebody's health, just like I said before. It's particularly a window into one's hormone levels, one's gut microbiome, gut health, and nutritional levels. It's a reflection on their inner health. And it does, of course, play a crucial role in the synthesis of vitamin D. So if we take a step back and look at the evolutionary history of the synthesis of vitamin D and the role it's played in the human evolution, the first human really was first in Africa, around 300,000 years ago, and they had dark skin, dark hair to protect themselves from the sun and its UV radiation. And because they were experiencing they were in such a high sun environment, they naturally would make a lot of more vitamin D because there was just so much sun, because just they're in that environment. Whereas as humans migrated to Asia and then later into Europe, then there were these genetic mutations that came along that became really helpful for people living in a lower sun environment. So these are the genetic mutations that allowed for lighter skin. And the lightness of the skin allows more UV radiation to get through to the melanin and then to go down and cause the stimulation of vitamin D to be synthesized in the body. And so these people with lighter skin, they had this evolutionary advantage to be able to live in low sunlight environments while still making adequate levels of vitamin D to keep their immune systems healthy and to prevent them from getting rickets and bone fractures and, all of these low vitamin D issues that play a crucial role in our evolution. And so really, vitamin D plays a key role in the evolution of our skin color. And so, as a person with dark skin, if you have dark skin and you're inside all day, you're going to be likely at a higher risk for having a low vitamin D level because your body is designed to need a little bit more sun exposure to create the adequate level of vitamin D, but that's an evolutionary advantage if you're outside for long periods of time in a really sunny environment, because the sun, while we need it, it's kind of like this double-edged sword. We have evolved to need the sun to be healthy. And then simultaneously we have, it's a ball of radiation that, can kill things, including humans. And so the skin, darker skin, is protective from that. So, like I said, it's an important piece of evolution. Just kind of interesting side note. Now, I mentioned this in the last workshop I did with you about detox, but I just wanted to revisit this idea that the skin is a detox organ. So this is just an image of the former president of Ukraine, and he was poisoned of dioxin. He was poisoned with dioxin, and eventually they discovered it was dioxin because he started getting these exudes on his skin. As you can see, his skin looks really horrible after being poisoned. But this is his body trying to get the dioxin out and finding any way possible, because the liver and the kidneys, the body knew that his liver and kidneys were not doing the job and could not do the job, and it would kill him if that was the only mechanism. And so it increased these phase 1 detox enzymes in the skin. So the body's amazing. Skin is amazing. We really need to learn about it and understand it because it's such an important part of our health. And, unfortunately, like I said, it's not being properly used and really treated. So, in my personal opinion. So we do live in a world where antibiotics, antibiotic topically, there's all sorts of things that are really breaking down our skin and setting us up for skin problems. And some of those things include antibiotics orally, antibiotics topically, antivirals orally, antivirals topically, disinfecting, just all the chemicals, living in a really super clean environment that is kind of like the bubble environment where your immune system is not allowed to be exposed to all of the bacteria and microorganisms that we really need and have evolved to need to live on planet Earth. The herbicides, insecticides, that we live in a world where it's just killing everything, and it's also killing us, and it's killing our skin biome and our gut microbiome. Toxins, chlorine, swimming in pools can affect your skin microbiome. Formula milk rather than breast milk makes a big difference in your microbiome of your whole body, including your gut and your skin. C-sections, I'll talk more about that later. Low antioxidants is key as far as if you have low antioxidants, you're going to have more skin problems. One of the best ways to protect your body from DNA damage, and DNA damage is what leads to so many inflammatory issues and cancer. One of the best ways to protect yourself from DNA damage is to make sure you have lots of antioxidants like vitamin E, vitamin C, glutathione, all of these key things. Too little or too much sun can be bad for the skin. High free radicals. So if you're eating a diet that's got lots of bad oils and processed foods and carbohydrates, you're, creating a toxic environment filled with free radicals that is also filled with, bad microbiome feeding carbohydrates. Vitamin deficiencies are crucial for, they will definitely set the stage for skin problems. So this, I want to talk a little bit more about a lot of the ideas that I covered in that last slide. So let's dive into some of those and break them apart. So this, on the left here, I just basically copy and pasted this from my book, The Iron Curse, and there's this myth that the sun is bad for you. And so the sun, we really need sunlight. Our sunburns are bad for you. Do not get sunburn. It's definitely bad for your skin and will increase your risk for skin cancer. Having said that, we have evolved to need sun, and our skin is, the primary organ that is being affected by the sun. Of course, the sun exposure to our retinas affecting our brain is important for circadian rhythm, but our skin being exposed to sunlight, near infrared radiation from the sunlight, makes 95% of the melatonin that we have in our body. And so there's two different types of melatonin. One of the types of melatonin is the type of melatonin, which melatonin is an important antioxidant that, it's actually a hormone, but it's an important antioxidant that's good for, healing up blood-brain barrier, good for your heart, good for your immune system, lots of different things. And so there's two different types of melatonin. One of them is the circulatory melatonin, which is what your body makes at night by the pineal gland. Your pineal gland makes the circulatory melatonin, and then that circulatory melatonin will get into your blood supply and, help you fall asleep and go to sleep. That's 5% of the melatonin that your body makes. The other 95% is circulatory melatonin, is subcellular melatonin. So subcellular melatonin is made by the mitochondria throughout your entire body. So we have trillions of mitochondria in our body, and each one of them makes a little bit of melatonin. And one of the things that stimulates the mitochondria to make melatonin is exposure to near infrared radiation. And that comes from the sunlight. So our bodies have evolved to need that sun exposure to allow the mitochondria to be stimulated to make the melatonin. And then the reason that the mitochondria make the melatonin is because, like I said, melatonin is a powerful antioxidant, and it is like a fire hose on the fire of inflammation that mitochondria are making, because mitochondria they make a lot of oxidative stress. They are very active. Think of them as like the combustion engine that's putting off lots of exhaust and toxins, but it's just working so hard that it's just creating all these toxic oxidative stress free radicals. And that they've evolved to just that's just part of it. And so they've evolved to make the antioxidants, make the melatonin, so that they can get rid of that toxic free radicals and kind of be like the catalytic converter on the vehicle that's putting off a lot of gas, exhaust. So the melatonin is like the fire hose on the fire of inflammation in the mitochondria. And what is the primary way that we make melatonin? Exposure to sunlight, near infrared radiation. So that is largely, you don't have to go out in the sun in the middle of the day and walk on the beach in Miami to get this, okay? If you can do that, then, more power to you. But you don't have to do that. You just can go out in the morning and the evening for a period of time and get that near infrared radiation. And that's, a completely different type of wavelength than what you would get in the middle of the day. And that will also help you make some vitamin D as well. So this is really key. Now, there are studies over the past decades that indicate that insufficient sun exposure may be responsible for 340,000 deaths in the United States and 480,000 deaths in Europe per year, and an increased incidence of breast cancer, colon cancer, hypertension, cardiovascular disease, metabolic syndrome, multiple sclerosis, Alzheimer's, autism, asthma, type 1 diabetes, and myopia. So sun exposure is necessary for the body to produce both melatonin, nitric oxide, and vitamin D, and sunlight is as necessary of an ingredient for health as food and water. Now, don't get a sunburn, don't go overdo it. You can get too much of a good thing, but it's just there's this myth that we need total exposure. And, our skin has evolved to handle the sun. Just the melatonin that the skin makes, that is made by the mitochondria, provides about a SPF 15 as far as, a protective effect. So our body has these protective mechanisms to allow it to be protected in the environment of the sun. It's just the healthier you are, the better they work. The sicker you are, the more holes you have, the more cracks there are to fall through. So here on the right of this slide, this article, which you can find on PubMed, there's the PubMed ID number. The title is Natural Antioxidants, Multiple Mechanisms to Protect Skin from Solar Radiation. And so this was an interesting article. I'm going to kind of cherry pick the highlight points that I want to talk about. You're welcome to go back and read the whole article. But so they talk about lots of different antioxidants that, you can get in supplemental form or in your diet. They're all found, either melatonin, which you make your body as a hormone, or like I said, you can get as a supplement. All of these you can get as supplements, but basically all of them they found were protective for the skin and protective against UV radiation, and changed gene expression to protect the skin. They were protective against DNA damage and aging. And so it's interesting to me, it's protective against inflammation, antibacterial, anti-inflammatory, even against skin cancer. With, of course, that's not surprising, because if it's protective against free radicals, then it's going to be protective against free radical-induced DNA damage. And if you have a lot of DNA damage, then you're going to be more likely to have cancer. So that's not too surprising. But it's key and it's important and it's interesting that you go to the dermatologist and they never talk to you about, you really need to be eating an antioxidant-rich diet. Consider these supplements that have been proven to be protective against radiation and skin damage and skin cancer. And, let's talk about your gut microbiome, because that's key. Those are steps that get passed over. What I have experienced firsthand, this is just me, maybe I'm the exception, but what I have experienced is, here's an antibiotic, here's a topical treatment, here's a non-insurance included laser package that's very expensive, and here's a, sunscreen that has chemicals that have been proven to cause cancer. So it's underwhelming, and, it's just more reason to stick around for the rest of this hour. So let's talk about sunscreen. I am not promoting this product on the left. The only reason I have this product on the left is because I unintentionally was a part of the big study that looked at sunscreens to identify benzene. I was reading an article one day on the internet, and they were talking about sunscreens, and they basically said, mail in the sunscreen you're using in an unopened bottle, and we will send you a report to check for benzene. And so, it's been on my radar, like most people who are into, holistic health and natural world, being healthy. It's been on my radar as far as sunscreens and the toxins that are in them for a long time. So this really was interesting to me. So this is the sunscreen that I mailed in, because this is what we I've decided I'm most comfortable with just based on the ingredients. And so I mailed it in, and they sent back a report that it just said it was, like almost zero as far as the benzene goes. And the range, they basically, the way they wrote the report, it is under the whatever acceptable range for benzene. Now, there could be other things in this sunscreen that are bad, and they just didn't give me a full report on everything in them. So I'm not like promoting this one, but I just thought that was an interesting story. This is still the sunscreen that we use in my house. If there's a better one out there, I'm more than happy to change. I don't particularly care what brand I use, but as a, person who feels like I don't like to wear a lot of sunscreen, I would prefer to just, not get sunburned and don't spend too much time outside in the sun. But as a light-skinned person that, has lived in a sunny environment in my whole life and, likes to go outside, and has, a child that spends lots and lots of time outside. Certainly, I think, like a lot of people, sunscreen is something that I feel the need to have one to use. And so I'm not saying you should or shouldn't use this one. I'm just telling you my story. But there are a lot of sunscreens that have been shown to have carcinogenic compounds in them, like benzene. So be careful and avoid the sunscreens that are sprays, because they are harmful to the lungs and possibly carcinogen. So that's my little 2 cents on that. Now, this was a research study that the one I'm about to talk about, this is a research study that I personally found very interesting. Because what they did here was they looked at vitamin B3, and they looked at which is niacinamide. They looked at the nicotinamide form of it, because that's the non-flush form. So if you're trying to give somebody niacin and you want them to take it and not stop taking it because they are flushing, then it's best to use the nicotinamide niacinamide form, which is why they use that in this study. And so they did the study in Australia. Australia has a huge rate of skin cancer because there's a hole in the ozone over that area. Also all these European people came down from a low sun environment to a very high sun environment. In Australia, they are very outdoors oriented, like to go to the beach. So they have a really high risk of skin cancer. And so they, do a lot of cool research, and they're really much more advanced as far as their diagnostic tools than us. Now, so they did this study, and they basically found that giving people 500 mil, and these are people that previously had a history of non-melanoma skin cancer, so basal cell or squamous cell carcinoma. They gave them 500 milligrams a day, and they found there was a 23% reduced risk of repeat basal cell or squamous cell carcinoma. They did not see a dramatic, significant decrease in melanoma. And then they also found there was a decrease in the actinic keratosis, which is precancers. They found 11% decrease at 3 months and a 15% decrease at 12 months. So that tells me that, the longer you kind of make sure you're getting plenty of these B vitamins, such as niacinamide and these other things that help to, repair DNA damage and prevent DNA damage, then you're, further decreasing your risk for skin cancer. But I found, this really interesting because personally, when I was in my early 20s, I had pellagra, which is vitamin B3 deficiency. And it was only diagnosed by my chiropractor, which is one reason that I'm now a chiropractor, but it was, very serious. And pellagra, vitamin B3 deficiency, it can cause skin type issues. It causes diarrhea, dermatitis, dementia, and death. So thankfully I didn't experience all of those, but came close. And so now years later, I did develop a squamous cell carcinoma that was only diagnosed because I had a mole removed as a cosmetic procedure off of my nose, and everybody was shocked when it came back as squamous cell, and they wouldn't even go in and do the Mohs without rechecking it because everybody was shocked. They were just like, there's no way that was squamous cell carcinoma. It looked so normal. When I found this research study that linked vitamin B3 helping prevent squamous cell carcinoma, it was kind of like, maybe that's part of why I developed squamous cell carcinoma, because I was so low in B3 for so long, as a lot of people with Crohn's are, and celiac disease are, just like, because I do have Crohn's and celiac disease too. So moving forward, there's not really a lot of surprises here, but vitamin E is known to be really good for the skin. The reason I bring this up is because, antioxidants like vitamin E, they are protective against free radical damage. And unfortunately, this is something that, our dermatologists are not telling us about, but they have, in this research study, which you can find on PubMed, they give all of these health problems, skin-related health problems, that vitamin E has been shown to be helpful for. I'm not trying to cherry pick just vitamin E and, B3 and all these things. I'm really just trying to paint a picture of how nutrition can be a powerful tool for protecting against skin issues. And so what they found was yellow nail syndrome got much better with plenty of vitamin E. This is yellow nail syndrome here in this top picture. Subcorneal pustular dermatoses. This middle picture is that. Cutaneous amyloidosis. This lower picture is that. Atopic dermatitis, skin blistering, psoriasis, cutaneous ulcers, skin cancer prevention, wound healing, melasma, acne vulgaris, scleroderma. All of these skin issues were improved with vitamin E. So just, I find that the more you know and explain things to people, the more likely they are to make the right choices, eat the right way, take their supplements, so on and so forth. So we're going to dive into the gut microbiome and the role that it plays in our skin health. And so you can thank your mother for seeding your gut flora and your mitochondria. So the mitochondria that you have came from your mother, which came from their mother. Male mitochondria quickly get destroyed after conception. And so the other thing that you largely get from your mother is your flora, which is largely, the first day that it starts, as far as the development goes, is largely the day you're born. And so a vaginal delivery versus a C-section is not going to determine the rest of your health. You can certainly be a C-section baby and still be healthy. It might just take a little bit of extra attention from your parents as far as your gut and your microbiome and things like that. But the research is very clear that C-section babies and formula-fed babies are more likely to have type 1 diabetes, atopic dermatitis, allergies, asthma, autoimmune diseases, eczema, less gut diversity. And that's largely because of the, lack of exposure to the good bacteria, to their skin, to, the bacteria they swallow going through the vaginal canal, and the lack of the good prebiotics that are in the breast milk that they're not getting if they're formula fed, the lack of the good bacteria that they're not getting if they're being formula fed. This is all kind of seeding the future health via the microbiome. So you cannot change your genes, but you can change your microbiome, and your microbiome largely, affects what genes get turned on. If you have a healthy microbiome, it can do a lot of good at preventing health problems, even if you have, quote unquote, bad genes. And the number of the human microbiome is much larger than the number of genes in our body. And the human microbiome is like this switch for turning on or turning off genes. So it's really important that we take care of our microbiome by eating right, prebiotics, probiotics, avoiding all of these bacteria killing things in our environment. So a lot of people know the term gut dysbiosis, but I want to talk about skin dysbiosis and how gut dysbiosis is related to skin dysbiosis. So gut dysbiosis is where you have bad bacteria in your gut, too much bad bacteria, you're going to get more inflammation. That leads to a leaky gut barrier. Then basically what happens is you get more pro-inflammatory effects. And that then leads to skin dysbiosis. And once that happens, then you're going to be losing your skin barrier integrity. And what does skin dysbiosis look like? Well, this is what skin dysbiosis looks like. And you can call it all sorts of different names. You can call it acne, erythema nodosum, pyoderma gangrenosum, neutrophilic dermatosis, erythema multiforme. You can call it whatever you want to call it, but this is what it looks like. Skin dysbiosis. Of course, it's more complicated than just having not the right bacteria on your skin, but it's the wrong bacteria creating the wrong chemicals, which break down your skin, which we'll talk more about in a second. But before we do that, I just wanted to talk about this research study, which was showing that pregnancy probiotics and atopic dermatitis. So that was the title of the study. And basically what they did was they gave these pregnant women with a positive family history of atopic dermatitis 4 to 8 weeks before delivery and 2 months up to 2 months of their child after their child's born. They gave them probiotics. And what they found was that a third of the study, maternal and infant supplements with Bifidobacterium breve and longum supported the preventative effect of atopic dermatitis. So it prevented atopic dermatitis. And I think that this is also one of those studies where if you continued even further past 2 months, then you would see even more of a muted effect. But certainly before, during, and especially in that short window of time right after a child was born, that is a really critical window for gut microbiome and skin microbiome exposure. And that's where, they've done studies where giving babies certain bacteria in the first 27 days of their life was like a 60% decreased risk of type 1 diabetes for babies that were at high risk of type 1 diabetes. But if you didn't do it in that first 27 days, it didn't seem to help as much. So it's really important that people kind of think of probiotics starting, not just months after the baby's born when they're starting to have problems, but really as a preventative thing for, the mother and the baby. And for me, what we would do with my daughter is I would just put a little bit of probiotic on my nipple, and then she would get, a little bit of probiotics through breastfeeding. And then I would take probiotics, through the whole pregnancy and after. So those are just some things that you might consider. So here's just a study about erythema nodosum, and this is kind of just the standard care. But the reason I included this is because it's kind of a window into the irony of they kind of know what's causing this, but they're not really addressing it. And so what they're basically saying here about erythema nodosum, which is where you get these nodules largely like on the extensors on the front of your legs. It's idiopathic, meaning they don't really know what's causing it. It can be caused by strep throat. It can be, increased risk with inflammatory bowel disease or inflammation. They treat it certain drugs, or it can be also brought on by oral contraceptives and some antibiotics. That's largely because the oral contraceptives and the antibiotics are bad for the gut microbiome, which was why they can lead to it. And they diagnose it just by kind of looking at it, or they might also run some labs and they might see like high C-reactive protein or ESR, or they might see, high white blood cell count, neutrophils, lymphocytes, probably high neutrophils on blood work. Or they might, look for a strep infection. But basically, this is maybe what they do to diagnose it. And then they would probably treat it with anti-inflammatory drugs, which, if you apply like a corticosteroid topically, then that's basically going to decrease the inflammation, but it's also going to cause more breakdown of the skin barrier and the gut barrier as well, because corticosteroids, we know, break down barriers, including the gut barrier and the skin barrier. So in a way, it's like you're borrowing from tomorrow's health for today's relief, which I understand, there is a need for relief. Having said that, it's really important to look for the underlying root cause simultaneously. And what I found is that again and again, they're not looking at the microbiome. Even in this, they even say, stool culture. They can do a stool culture to help with the diagnosis. When has your dermatologist ever ordered a stool culture? I don't even know if they would feel comfortable ordering a stool culture, not because they shouldn't, but because it's one of those, well, if you want a stool culture, go to a gastroenterologist, that type of thing. And then the gastroenterologist, orders like not as good of a stool culture as you would maybe like to have, but insurance pays for it. So you take what you can get, and maybe it doesn't give you the answers that you want. And then you're kind of on this hamster cycle, just running on spinning the wheels. So, but they're not looking at the microbiome, dysbiosis, probiotics. And, it's the whole give you a diagnosis code, give you a prescription, and, I need to move to the next patient because your 5 minutes is up. So moving forward, this slide, basically, we're looking at this study that looked at prebiotics and atopic dermatitis prevention and management. And they're comparing a, healthy, normal skin microbiome, which comes from having a healthy gut microbiome. And what they're saying here is that when you have a healthy gut microbiome, your basically what happens is the good bacteria will create short chain fatty acids like butyrate, which you might find butyrate in like ketone supplements because butyrate's a ketone. But the bacteria in your gut make that butyrate, and then the butyrate is really important for keeping the intestinal cell lining, the enterocytes, healthy. But also it keeps the leaky gut at bay and prevents leaky gut, which then prevents all this extra inflammation. And then you also get all of that extra butyrate to go to the skin and keep the skin healthy. So this is versus on the right, where you have gut dysbiosis, poor gut microbiome. You have not healthy good bacteria in your gut. And then you're going to be more likely to not make those short chain fatty acids like butyrate, be more likely to have leaky gut and get all of those inflammatory cytokines in your blood. And then that's going to create more allergic reactions and histamines, which is more likely to create atopic dermatitis. And so they have said, which is so clear, the skin and gut microbiome have an immense impact on atopic dermatitis pathology. And prebiotics, which is the short chain fatty acids, prebiotics favor the growth of good bacteria. So, feeding the prebiotics are really like the food, like the whole foods, like the fiber. So the prebiotics are like the fiber, the polyphenols, it's like what you find in healthy foods, vegetables, fruits that are going to feed the good bacteria. And then those good bacteria can then put off the butyrate. So, and keep your gut lining healthy. So again, when you have somebody with atopic dermatitis, which there are more and more people that have this because more and more people are becoming inflamed and leaky gut and autoimmunity, then the research shows you need to be looking at the gut. To just drive that home a little bit further, basically in this study, the gut microbiome axis is a major regulatory of the gut-skin axis. They found that in cases of disturbed intestinal barrier, intestinal bacteria, as well as intestinal microbiota metabolites have been reported to gain access to the bloodstream, accumulate in the skin, and disrupt skin homeostasis. So when you have bad bacteria in your gut, it can actually go through the leaky gut and get into your blood and go to the skin. So you've got to not just, if somebody's having chronic skin issues, you've got to look at the gut. If someone's having skin issues, you've got to look at the gut. DNA and intestinal bacteria has been isolated from psoriatic patients. So the gut bacteria can get to your skin, which is why it's so important to look at the gut microbiome. So rosacea, we're going to talk about rosacea for a second here. Now, rosacea, this is rosacea here on the left, and it's a chronic inflammation of the skin. It can affect the eyes as well, and it largely is triggered by spicy foods, heat, cold, wind, alcohol, sun exposure, chronic stress, corticosteroids, blood pressure drugs that increase nitric oxide. These are things that are triggers. Now, there's a reason why each one of these is a trigger, whether it's inflammation or causing more gut dysbiosis or, just increasing nitric oxide will increase blood flow, opening up, dilating the blood capillaries, which will make things more red in some people. And the traditional treatments, which I can tell you are underwhelming because I've tried them all, is lasers, which are not covered by insurance, but very expensive. Topical and oral antibiotics, which is interesting because I'll tell you more why it's interesting in a second. You'll have to stay tuned. Topical anti-inflammatories. So they have their tools and they don't work that great, but it's what they use. And it's considered to be benign, but really what rosacea is often a SIBO problem. I'm not going to say it's always a SIBO problem because then somebody's going to come and tell me I'm wrong, and I don't want to be told I'm wrong. So I'm going to say it's often a SIBO problem. So there is a strong association between SIBO and severe dermatological conditions, including not just rosacea, but systemic sclerosis, and I'll talk about why that is in a minute. But certainly anybody that has rosacea, you need to be looking at their gut. So what is SIBO? SIBO is small intestinal bacterial overgrowth. Some of the symptoms are abdominal pain, diarrhea, constipation, or both, bloating and flatulence. It can be diagnosed with it can be diagnosed with a glucose or lactulose breath test, which really, in my opinion, you need to do in a doctor's office. They have some where you mail them off. I'm not fully on board with those as far as their accuracy, but I think really you need to do it in a doctor's office where you're sitting there and get the test done in the doctor's office, which would require you to go to a gastroenterologist. So it's not easy to get one of these, tests in the office. But what you can do is you can look at what are the type of things that are maybe causing the SIBO. Do people feel a relief when they eat a low carbohydrate diet or take antibiotics? but you can do this breath test if you want to confirm the diagnosis. So if somebody takes antibiotics, either, prescription or herbal, or they get on a real low carb diet and they have a decrease in their abdominal pain, diarrhea, constipation, or both, then that is a possibility that there is a SIBO type issue. If they get on a low FODMAP diet and a specific carbohydrate diet and they feel much better, that is an indicator you might be dealing with a SIBO type issue. And so we'll talk about what's actually causing SIBO, because what SIBO is, it's really a symptom of another problem that if you can fix, you need to fix it. Diagnosing SIBO is, a step in the right direction. But if you're not explaining to somebody why they have SIBO and correcting that if you can, then I feel like that's an important step that needs to be done more. The diagnosis is one step, and treatment is one step, but why is it happening is the step that's being missed, in my opinion. And we'll talk about that in a second. So basically, if we look at your colon and then your small intestine, the number of bacteria increases as you go down from the mouth to the anus. Okay, so the number of bacteria increases and the type of bacteria increases or changes. So the bacteria that don't need as much oxygen, that are more anaerobic, they are going to be in the colon. The bacteria that need more oxygen, they're going to be, in the mouth, stomach, all that type of stuff. So theoretically, we should not have a lot of bacteria in our small intestine. We should have some. Healthy intestinal tract should have some, but not too many. You should have plenty of the bacteria in your colon. And then the body has this thing called the ileocecal valve, which separates the small intestine at the ileum from the cecum and the large intestine. And if that ileocecal valve is functioning properly, then that should stop bad bacteria, or not just, that should stop bacteria from going from the colon up to the small intestine. Now, some people, like myself included, because I have Crohn's and they removed my last foot of my small intestine, the ileum. I don't have an ileocecal valve. And so I have issues with SIBO, and it's not something that we can easily fix because I don't have that door to stop the bacteria from going from the colon to the small intestine, which means I have to be really, really careful about carbohydrates, not eating too many carbohydrates, occasionally doing herbal, antibacterial things to kind of clean things out. But that explains why I had such bad rosacea after having that part of my small intestine removed. Now, my dermatologist never explained that to me. I knew it had to do with my gut. I knew my diet was a big part of it. They didn't care. What I found, what really helped me with rosacea, was drinking fresh cabbage juice. That's what I said, folks. You just juice the cabbage, raw cabbage. It's disgusting. But I found that it helped a lot with the rosacea. And the reason that it was helping is because cabbage juice is amazing for healing up the gut, but it also has some good antibacterial properties to it. You want to heal up a GI ulcer? In addition to glutamine and probiotics and prebiotics, butyrate, cabbage juice is an amazing thing. You just have to drink it, and it's nasty, but it's good for you. So with SIBO, we'll talk about what is actually causing SIBO. And like I said, it's a symptom. My SIBO is a symptom of me not having an ileocecal valve. It was an iatrogenic induced SIBO. They fixed one problem, it's caused 20 others. And so basically, and I would have preferred them just, finding my underlying problem in the first place, which was dietary food issues, and maybe prevented me from having Crohn's, but that didn't happen. So anyways, moving forward. So this, what are some conditions that can increase your risk for SIBO? Low stomach acid, so drugs can cause that, stress, autoimmune diseases. There's lots of things that cause low stomach acid. If you don't have enough stomach acid, then you're going to have, then you're not going to be killing the bacteria and the parasites and the things that you're eating in your stomach, and then they're going to go from your stomach into your small intestine. So this is the issue. Bacteria are either coming down from your mouth and your stomach into the small intestine, and there's too many, or they're coming up from your colon into the small intestine, and they shouldn't be coming up. And so the question is why? If they're coming down from your stomach and you're taking an acid producing drug, or you're underneath a lot of stress, which is reducing acid, or maybe you have an autoimmune disease that's attacking your pyloric cells and stopping you from being able to produce hydrochloric acid, then you would be more likely to get SIBO, not only just SIBO, but also parasites. Okay. Or maybe you have H. pylori. H. pylori can decrease your risk, decrease your ability to make hydrochloric acid and increase your risk for SIBO. Drugs that decrease motility. So here's the other problem. It's not just about the bacteria coming down or up. It's about it not moving through like it should. So if you have decreased motility, maybe you have, constipation, maybe you have constipation from scleroderma. This is why people with scleroderma are more likely to have SIBO, because their digestive system becomes scarred up and sclerotic, and then it's not moving like it should because those muscles have been replaced by scar tissue, and scar tissue doesn't work very well at moving peristalsis food through the gut. So, do you have an autoimmune disease that's causing decreased motility? Multiple sclerosis can do this, because if the neurons are not firing properly from your brain down to your gut, then the gut's not going to move. If it's not getting the message from the brain, it's not going to work. So do you have Parkinson's disease? Decreased gut motility with Parkinson's disease. Gastric bypass surgery. You get gastric bypass surgery, you are now at an increased risk for SIBO. Decreased bowel transit time. You need around 12 to 18 hours. If you're not pooping every day, at least once a day, you have a problem. And you can test your transit time with the blue poop test. Hypothyroidism. Do you have low thyroid? If you do, then you probably have decreased gut motility, and then you're at a higher risk for decreased gut motility, and again, increase your risk for SIBO. Antibiotic use, that can both kill the bacteria, providing you a temporary relief, but then it can also create a future SIBO type issue, because the wrong bacteria grow back, and then you get this gut dysbiosis, which can create issues. Taking painkillers, that can cause decreased gut motility, increased risk for SIBO. Depressed immunity. If you don't have enough secretory IgA, then your immune system's going to have a hard time, keeping the bad bacteria down, or just the bacteria count down. And then you're going to be more likely to have an overgrowth of bacteria in your small intestine. Crohn's, huge risk for SIBO, because with Crohn's, you have a lot of people like myself that don't have that ileocecal valve, or they have so much inflammation in that area that it's not closing like it should. So any type of a surgery where they did a resection, any type of a surgery of your digestive system, you're going to be at a higher risk for SIBO. Fistulas between the colon and the small bowel, it's like a little tunnel that goes between the two. That's just like, a little tunnel taking bacteria from one place that they, should be to a place that they shouldn't be. Chronic pancreatitis, because you're not making enough of the digestive enzymes. Chronic kidney disease can affect small intestinal motility. Collagen vascular disease like lupus, scleroderma, rheumatoid arthritis. Again, you're dealing with an autoimmune disease that is either scarring up the intestinal lining, decreasing its ability to work. Stress. Stress doesn't only decrease hydrochloric acid production, it can decrease gut motility. A lot of people, when they get stressed, they can't poop. It's common. You've got to fix the brain. Diabetic enteropathy, damage to the nerves that innervate the digestive system. Again, you have diabetes, it's going to destroy your nervous system. Not only are you going to get numbness in your feet, peripheral neuropathy, you also are going to not be able to poop because the nerves are not working. The nervous system's getting destroyed by high sugar. Low bile production. Bile is important for killing bacteria. You're not making enough bacteria, you're going to be more likely to, you're not making enough bile because your liver is toxic and your gallbladder sludgy, you're going to have more SIBO. Excess estrogen, that can decrease bile, but it can also change the antimicrobial environment of your small intestine. Phosphatidylcholine or choline deficiency. Why? Because if you have choline or phosphatidylcholine deficiency, your liver's not going to be working very well. Your liver makes bile. If you don't make bile or you don't secrete bile, you're going to have more SIBO. Alcoholism, again, you're just feeding the bacteria, creating leaky gut. Fatty liver, celiac disease. Celiac disease more likely to have SIBO, and there's a lot of different reasons for that. Some people with celiac disease actually get constipated. A lot of people think of celiac disease as a diarrhea disease. That's wrong. It's not just a diarrhea disease. It can cause diarrhea, but a lot of people with celiac disease, they have decreased gut motility. Pancreatic, not making enough pancreatic enzymes, vagus nerve issue. If somebody cut your vagus nerve, which is a therapy that occasionally people do, I'm not a fan, but it does happen occasionally, more likely to have SIBO because you don't have enough stomach acid, things are not moving. Diverticulitis, partial obstruction of the small bowel, and infections such as Lyme, EBV, herpes zoster. So I think I just made everybody think about SIBO a little bit differently than they did before this slide, I hope. This is an important slide. I hope you spend some time thinking about it. The only reason I spent so much time talking about it and putting it together is because I think it's important, and it's because SIBO is largely a symptom, and I don't think that the underlying problem is often getting addressed like it should. I think there's a lot of, my doctor said I had SIBO and said I need to take this. Okay, that's great, but why do you have SIBO? And can we fix that? That's what I want to know. Here's some of the extrinsic factors that can alter the gut microbiome and may influence the development of SIBO. FODMAP diet has been shown to be good for SIBO. Don't just say go get on a FODMAP diet, because there's some really junky foods on the FODMAP diet. Like, actually look and explain to people what should you be eating within that type of a diet if you're going to give them that type of a recommendation. Proton pump inhibitors, anti-motility agent, fiber. So fiber, is important for our digestive system because we need it to make butyrate, but fiber can also, feed some of that SIBO. So if somebody's like, I take fiber and I'm worse, they probably have SIBO. And they probably have SIBO because they're like constipated or something. Probiotics can help. Antibiotics can cause, but can also treat. If somebody, has temporary relief from an antibiotic, SIBO should be a diet that you work through. Protective factors that protect against the development of small intestinal bacterial overgrowth: plenty of hydrochloric acid, bile acid, pancreatic enzymes, healthy liver, motility, and plenty of secretory IgA. Here was a study that actually looked at herbal treatments versus prescription treatments, and the herbal treatments did really well. So these are some of the things they looked at: oregano, sage, lemon balm, et cetera, et cetera. And in this study, they even said that the prevalence of side effects in the rifaximin group, which is an antibiotic, included C. diff into non-C. diff associated diarrhea. And the herbal group, which is the group that got, the herbs that oregano, et cetera, only one case of non-C. diff associated diarrhea was observed. Perhaps the herbal therapies are less disruptive to the gut microbiome, and while producing efficacy in resolving SIBO, there appears to be less risk of C. diff, which had also, they were much cheaper. So the drugs, they said, their words, higher cost and risk of toxicity. Do you want to prevent somebody from getting C. diff while they're on antibiotics? Give them Saccharomyces boulardii. That is the only thing that will survive antibiotics. As soon as they're done with antibiotics, give them lots and lots of high quality probiotics. That's a huge tool for preventing C. diff. Acne. I'm going to burn through some topics real fast here. Bear with me. Acne, we all know what it is. It's largely an inflammatory issue that's being driven by carbohydrate-rich diet, poor microbiome in the skin. And interesting enough, there's lots of different causes, but one of the interesting microbiome clinical pearls is that the Staphylococcus epidermis, which is a bacteria on the skin, produces these short-chain fatty acids like butyrate that basically prevent the acne bacteria from surviving. So, and then they showed that this good bacteria that makes the butyrate that prevents the acne bacteria from growing is more likely you can promote that good bacteria with the lactobacillus supplementation. How cool is that? Oh my gosh, I'm going to go over my hour, folks. Bear with me. Forgive me. This study is about potential clinical applications of the postbiotic butyrate in human skin diseases. So I cherry-picked some information. I'm going to summarize it for you. Short-chain fatty acid butyrate, which, like I said, butyrate's a ketone. You often find in ketone-type supplements. It has been shown to have many protective effects on the digestive system and the brain, also on the skin, psoriasis, atopic dermatitis, wound healing, decreasing UV radiation. This is a good study. Go back and look at it. Butyrate is key. I love this image. It's so great. It's from the study I just talked about. What this image is showing is you get all these bacteria and you get a bunch of fiber, and maybe you take some butyrate supplements and, some type of a ketone supplement or something. And then you basically get all this butyric acid, and then the butyric acid feeds the intestinal lining, the enterocytes, and the enterocytes are so happy. And then what happens? What happens is you get more T regulatory cells, and that decreases your risk for autoimmune diseases, and it decreases inflammation. What else do you get? You get an increase in GLP-1. What is GLP-1? Have you heard of Ozempic? Ozempic increases GLP-1. Butyrate appears to help the body in some mechanism to make more GLP-1, which then helps do multiple things: increase leptin, increase breakdown of fat, decrease insulin resistance, decrease inflammation, increase insulin secretion. But also it's good for the skin. All of this butyrate is so good for the skin. And so I take butyrate supplements. I also try to eat lots of fiber, take probiotics. I recommend you consider those things too for you and your patients. All right, summarize here. Give me this last slide. Okay, I lied. There's two more. Dermatitis herpetiform. This is a skin condition that is from celiac disease. So celiac disease is not just a digestive disease. It does create skin issues too. Dermatologists are not great at diagnosing this. But if you see somebody and they have a celiac gene, which I put them here down in the bottom left corner for you, if you see somebody and they have a celiac gene, a gluten-free diet might help their skin issues go away if they're having this horrible skin rash. So consider that. So if somebody's skin rash gets much better on steroids, well, that's a good sign. It's inflammatory and it might be dermatitis herpetiform. Look at their genes. Do they have the celiac gene? You can order the celiac blood panel, to see if they have celiac, wheat, gluten, whatever antibodies, but definitely do something rather than just not have it in your diff dye. Skin's an inside job, folks. Learn about it, use it. Thank you for your time. Please keep in touch on, social media. I have my previous book, The Genetic Testing, Defining Your Path to a Personalized Health Plan book. And then my upcoming book, which I'm really excited about, The Iron Curse, which is about iron disorders, hemochromatosis, iron overload. And I have that also coming out and I'm excited about it. So anyways, a lot of people with hemochromatosis get this bronzing of the skin. And I don't have enough time to go into why that is today, but hemochromatosis does create skin issues and it does create gut issues too. So anyways, thank you for your time. Have a wonderful day and I'll see you next time.